Good day, welcome to our rationalization for long test 3 for Nloa 1. Let's begin with our first question. So my topic is actually about care of healthy at-risk mother and child, specifically D1, or care of pediatric clients with respiratory disorders. Question number 1. The parent of an 18-month-old child calls the child's primary health care provider and states, "My child coughed all night long. She doesn't seem to be too sick, and she has no temperature. What can I do to help her and the rest of us to sleep tonight?" Which of the following responses is appropriate for the nurse to make? Is it A, B, C, or D? The correct answer here is letter C. So you could try raising the head of the baby's crib by putting books under the client's front feet. So elevating the head of the bed or crib helps use gravity to reduce nasal congestion and postnasal drip, promoting better respiratory expansion and sleep for a child with a nighttime cough. Letter A, steam vaporizers pose a severe risk of accidental burns and are no longer recommended right next to a crib, and cool mist humidifiers are preferred. And letter B is also wrong because non-prescription cough and cold medications are not recommended for children under 4 to 5 years of age due to potential toxic effect. And finally, letter D is also wrong because a child has no fever and does not sound acutely ill, indicating a viral origin rather than a bacterial infection that requires antibiotics. Number 1, answer C. Number 2, a child is seen in the emergency department. The nurse hears a high-pitched squeal every time the child inhales. The parent states that the child's fever is very high, and in addition, the child is gasping for breath and sitting in a tripod position. Which of the following actions would be appropriate for the nurse to perform at this time? Is it A, B, or C, or D? The correct answer is letter D. Get immediate medical attention for the child because the symptoms described, high-pitched inspiratory squeal or stridor, presence of high fever, gasping for breath, and sitting in tripod position, are classic hallmarks of acute epiglottitis, which is a medical emergency. The priority is to obtain immediate medical attention, such as intubation or tracheostomy equipment, must be at hand because the airway can completely occlude at any moment. Letter A and B are actually wrong because inspecting the throat with a tongue blade or giving fluids can cause localized spasm, triggering immediate and fatal airway obstruction. And letter C is also wrong because vital signs are important. Waiting to assess lung fields delays life-saving medical intervention. Therefore, the correct answer for number 2 is letter D. Number 3. A nurse is educating a group of parents regarding the rationales for the administration of vaccinations. The nurse should advise the parents that the vaccine that prevents infection from which of the following diseases has helped to reduce the numbers of children diagnosed with bacterial croup. Is it A, B, C, or D? The correct answer is letter B. Haemophilus influenza type B. Of course, we know that epiglottitis, often referred to as to clinically in this practice context alongside severe bacterial croup syndromes, was historically caused primarily by Haemophilus influenza type B or Hib. The widespread use of the Hib vaccine has drastically reduced the incidence of this life-threatening pediatric airway infection. Choices A, C, and D protect against hepatitis A. Rotavirus is for gastrointestinal, and Neisseria meningitis is meningitis sepsis, and none of which are major causative agents of croup or epiglottitis. Number 3 is letter B. 4. A newborn baby has been diagnosed with cystic fibrosis. Regarding which of the following characteristics of the disease should the nurse forewarn the parents? Is it A, B, C, or D? The correct answer is delta. Because we know that cystic fibrosis or CF is an autosomal recessive exocrine gland disorder. It leads to the production of abnormally thick viscous secretions, particularly affecting the respiratory tract, that's causing mucus plugging and chronic infections and the pancreas. Choices A and C is actually talking about chronic conjunctivitis and recurrent vomiting are not primary characteristics of cystic fibrosis, while letter B, children with cystic fibrosis experience pancreatic insufficiency, leading to malabsorption of fats and proteins, which causes weight loss or difficulty gaining weight not rapid weight gain. Of course, there should be no rapid weight gain. Number 4, answer delta. Number 5, the parents of a child who has some multiple respiratory infections since birth tell the nurse, when we kiss our child, all we can taste is salt. It would be appropriate for the nurse to suggest to the primary care provider that the child be assessed for which of the following illnesses: cystic fibrosis, asthma, bronchiolitis, or pharyngitis. Of course, the sweat chloride test is the gold standard for diagnosing cystic fibrosis. Parents often report a distinct daily salty taste when kissing their child due to the defective chloride channels that prevent the reabsorption of sodium and chloride in sweat glands. Choices B, C, and D are respiratory illnesses but do not alter exocrine sweat glands secretions or can cause skin to taste salty. 5, answer alpha. 6, a neonate has been diagnosed with cystic fibrosis. The nurse should educate the parents regarding which of the following dietary needs of their baby. The baby must receive dose of folic acid 3 times each day. The baby must never consume any milk or milk product. The baby must receive pancreatic enzymes before bedtime every night. Or the baby must consume a pre-digested formula that is high in calories. Number 6, the correct answer here is letter D. Due to pancreatic enzyme deficiency, infants with cystic fibrosis cannot properly break down nutrients, leading to malabsorption and failure to thrive. They require a high-calorie, high-protein diet and often a pre-digested hydrolyzed formula that is easier to absorb. Letter A, folic acid 3 times a day is not standard CF or cystic fibrosis nutritional therapy because they require fat-soluble vitamins such as vitamin A, D, E, and K. For letter B, milk products do not need to be temporarily eliminated through adjustments are made based on digestive tolerance. And letter C, pancreatic enzymes must be given with all meals and snack, not just once at bedtime. Number 6, answer delta. 7, a children with a 10-year-old child has cystic fibrosis. If it would be appropriate for the nurse to advise the parents that the child should be monitored yearly for which of the following illnesses: lupus, arthritis, hyperthyroidism, or diabetes mellitus. The correct answer here is letter D. As children with cystic fibrosis grow older, fibrotic scarring of the pancreas destroys the islets of Langerhans, leading to insulin deficiency. This complication is known as cystic fibrosis-related diabetes, and annual screening, typically via an oral glucose tolerance test, begins around age 10. And lupus, arthritis, and hyperthyroidism are not standard high-risk systemic complications directly stemming from exocrine pathophysiological damage of cystic fibrosis. 7, answer delta. 8, a 4-month-old child is admitted to the pediatric unit with a diagnosis of RSV, bronchiolitis. The child is to receive ribavirin every 12 hours times 3 days. Which of the following actions by the nurse are appropriate? Select all that apply. The correct answer here is 1, 2, 3, 5, and that's letter B. Ribavirin is reconstituted with water, and RSV requires strict contact and droplet isolation to prevent nosocomial spread. And number 3, continuous pulse oximetry monitors oxygen status during respiratory distress. And number 4 is actually incorrect because ribavirin is administered by inhalation using a small particle aerosol generator, never as an intramuscular injection. Therefore, eliminate number 4. Number 5 is correct because ribavirin is highly teratogenic. Pregnant healthcare providers or family members must avoid exposure to the aerosolized mists. The correct answer for number 8 is letter B. Let's proceed to question number 9. A baby is born 12 weeks preterm. The nurse should determine that which of the following monthly medication injections should be appropriate for this child to receive. The correct answer is letter B, Synagis or palivizumab. Of course, this medication is a monoclonal antibody given intramuscularly monthly during RSV season to high-risk infants such as those born prematurely, such as less than 35 weeks gestation, and those with chronic lung disease to prevent severe RSV infections. Choice letter A and D provides passive immunity to specific exposures such as hepatitis B, and chickenpox, but are not routine monthly prophylactics for preemies. And letter C, Dornis alpha is an inhaled mucolytic used in cystic fibrosis, not a preventive injection for premature infants. The correct answer for number 9 is letter B. 10. A nurse monitoring a preterm baby with RSV bronchiolitis notes that the baby is exhibiting signs of respiratory distress. Which of the following signs did the nurse observe? Select or apply. The correct answer here is 2, 3, 4, and 5. That's letter B. Because the classic signs of pediatric respiratory distress include tachypnea or the rapid breathing, there's nasal flaring or widening of nostrils to pull air in, and of course expiratory grunting that creates positive and expiratory pressure to keep alveoli open, and intercostal retractions, which is the use of accessory muscles. Number 1 is actually wrong, because huffing is a controlled force expiratory coughing technique taught to patients with cystic fibrosis or COPD in order to clear airways, and it is not an involuntary physiological sign of acute respiratory distress in an infant. Number 10, the answer, bravo. 11. An 8-year-old child who has a history of asthma is seen in the office of the school nurse with coughing and sneezing. Which of the following actions should the nurse perform first? The correct answer here is alpha, because the nursing process indicates assessment before action. Measuring the child's peak expiratory flow rate, or the PEFR, immediately quantifies the severity of the airway constriction against the person's personal best, guiding whether rescue medications or emergency interventions are required first. Letter B is wrong, because education is a long-term goal and is inappropriate during an acute asthmatic exacerbation. And C and D are also wrong, because transporting to the ED or calling parents are secondary actions that should follow immediately after objective assessment and emergency protocol execution, like administering a rescue inhaler. 11 is letter A. 12. A 10-year-old child has been prescribed a meter-dose inhaler administered bronchodilator. Which of the following actions should a nurse teach the child to perform when taking the medication? To have the correct answer here is C. That is to maximize the amount of medication that reaches the lower airways, and the patient must exhale fully and completely right before activating the meter-dose inhaler. Letter A is wrong, because MDI canisters must be shaken vigorously before used to mix the medication propellant. And letter B is also wrong, because patients should wait 1 to 2 minutes before puffs of a bronchodilator to allow the first puff to dilate the airways. And letter D is also wrong, because the container is compressed at the start of a slow, deep inhalation, not held compressed for 30 seconds prior. Number 12, answer Charlie. 13. A 3-year-old child has been diagnosed with asthma, is being prescribed albuterol or Ventolin by a nebulizer as a rescue medication for acute episodes. The parent should be advised that the child may exhibit which of the following common side effects of the medication? A, B, C, or D. The correct answer here is alpha, because albuterol is a short-acting beta-adrenergic agonist, because it stimulates the sympathetic nervous system. Common systemic side effects include tachycardia. There is presence of tremors, hyperactivity, nervousness, and also insomnia. Letter B, that the lethargy, constipation, and weight gain are parasympathetic or metabolic traits that run directly opposite to the stimulatory profile of a beta agonist. Number 13, the answer is alpha. Let's proceed now to D2, which is care of pediatric clients with cardiovascular disorders. 14. A nurse is assessing a 1-day-old sleeping baby in a well baby nursery. Which of the following assessments should a nurse report to the neonatologist? Is it A, B, C, or D? The correct answer here is letter C, because the normal respiratory rate for a newborn ranges from 30 to 60 breaths per minute, while 52 ppm is technically within that window. A sleeping newborn should ideally have slower, quiet respirations. However, when evaluating this question under traditional testing matrices, the elevated sleeping baseline or an apical heart rate of 179, which can be normal during crying activity but high for deep sleep, requires close monitoring. However, a respiratory rate approaching the ceiling during quiet sleep warrants reporting to rule out early respiratory distress or transient tachypnea of the newborn. So 14, the answer here is letter C. 15. A baby exhibiting no obvious signs of congestive heart failure has been diagnosed with small ventricular septal defect. Which of the following information should the nurse explain to the baby's parents? Is it A, B, C, or D? The correct answer is Bravo. A large majority, up to 75 to 80% of small asymptomatic ventricular septal defects close spontaneously during the first year or two of life without surgical interventions. Letter A is wrong because open heart surgery within a week is only for severe symptomatic defects causing intractable heart failure. And letter C is also wrong because congenital heart defects typically develop earlier during the embryonic period or organogenesis, which is first trimester or weeks 3 to 8. And letter D is also wrong because high-calorie formulas are reserved for babies showing failure to thrive due to severe congestive heart failure, which these infants does not have. 15, answer Bravo. 16. A nurse is educating the parents of a child with an atrial septal defect regarding the child's condition. Which of the following information would be appropriate for the nurse to provide? The correct answer here for number 16 is letter C, because an atrial septal defect causes a left to right shunt because pressure on the left side of the heart is greater than the right. Oxygenated blood from the left atrium backflows into the right atrium and re-enters the pulmonary system, causing pulmonary volume overload and forcing the heart to work harder. Letter A is wrong because ASD is an acyanotic defect because blood shunts left to right, or oxygenated blood goes to lungs, not unoxygenated blood to body. And letter B is also wrong because a hole between the aorta and pulmonary artery describes a patent ductus arteriosus. And letter D is wrong because high RBC count or the presence of polycythemia is a compensatory mechanism for cyanotic heart defects not typical for atrial septal defect. 16, answer Charlie. 17. A newborn baby is receiving digoxin or lanoxin of furosemide Lasix for congestive heart failure. Which of the following actions would be appropriate for the nurse to perform? 17. The correct answer is Delta. Furosemide or Lasix is a potassium-wasting loop diuretic. Therefore, it can cause hypokalemia, in which hypokalemia is going to have a decrease of potassium for less than 3.5 milliequivalent per liter, which synthesizes the myocardium to digoxin, exponentially increasing the risk of lethal digoxin toxicity. Therefore, a potassium level of 3.2 milliequivalent per liter requires a nurse to hold both medications and report immediately. Letter A is wrong because a normal newborn heart rate is 110-160, and 170 is elevated, but digoxin is held for bradycardia. Typically, that's 90 to 110 beats per minute in newborn and not a tachycardia. Letter B is also wrong because a therapeutic digoxin level ranges from 0.8 to 2.0 nanogram per ml, or 1 nanogram per ml is perfectly therapeutic. And letter C is also wrong because a weight gain indicates fluid retention, meaning the diuretic is needed, not held. 17 is Delta. 18. A baby that was born 5 minutes earlier is tachypneic, tachycardic, and markedly cyanotic. A stat echocardiogram confirms the presence of a cyanotic congenital cardiac defect. Which of the following defects would be consistent with the assessment findings? 18. The answer is Bravo. Transportation of the great vessels is a cyanotic congenital heart defect where the aorta exits the right ventricle and the pulmonary artery exits the left ventricle. This creates two independent parallel circuits, leading to profound cyanosis and respiratory distress immediately at birth once the fetal shunts being closed. Choice A, C, and D, and that includes patent ductus arteriosus, atrial septal defect, ventricular septal defect, are all cyanotic defects characterized by left to right shunting of blood. 18 is Bravo. 19. A neonatal cardiologist ordered digoxin for a newborn in congestive heart failure. The baby weighs 7 pounds and 8 ounces and is 21 inches long. The drug reference states for full-term newborn 8 to 10 microgram per kilogram per day in divided doses every 12 hours. Which of the following orders would be safe for the nurse to administer? Is it A, B, C, or D? The correct answer is B. So what you will be doing is convert weight to kilograms, and that will result into 15 microgram every 12 hours, sits perfectly within the safe therapeutic range of 13.64 to 17.05 microgram per day. 19. The correct answer is Bravo. 20. A 7-year-old child has been diagnosed with rheumatic fever. Which of the following physical findings would a nurse expect to assess? The correct answer here is letter B. Migrating polyarthritis or inflammation causing warm, painful, and swollen large joints like the knees, elbows, and ankles is one of the primary Jones criteria used to diagnose rheumatic fever. Letter A is a characteristic rash of rheumatic fever is considered to be erythema marginatum, which is non-pruritic macular rash with red margins, not a vesicular fluid-filled rash. Letter C and D is also wrong because right upper quadrant masses and scleral icterus jaundice point to a hepatic biliary pathologies, not a rheumatic fever. 20 is Bravo. 21. A 12-year-old child has been diagnosed with Group A strep pharyngitis. The primary healthcare provider has ordered penicillin 5 mg POTID for 10 days. Which of the following questions is important for the nurse to ask the parents and the child before giving the medication? 21. Answer Alpha. Because there's a need for us to have compliance and is considered to be absolute priority when treating Group A beta hemolytic streptococcal pharyngitis to prevent the development of acute rheumatic fever. The nurse must assess for potential barriers for completing the full 10-day course of oral antibiotics before the patient leaves. Let it be strong because a nurse cannot alter provider's route prescription on a whim. And C and D are also wrong because while epidemiologically interesting, these questions do not secure immediate medication compliance. 21 is Alpha. 22. A child has been diagnosed with chorea has been admitted to the pediatric unit with a diagnosis of rheumatic fever. Immediately prior to admission, the child's throat culture was positive for Group A strep. Which of the following actions should a nurse perform when administering the child when admitting the child? The correct answer here is Charlie 1, 2, and 5. Because chorea causes sudden, involuntary, aimless, jerky movements, padding the headboard prevents accidental head trauma during involuntary thrusting. And number 2, Group A strep pharyngitis require droplet precautions until 24 hours after starting effective antibiotic therapy. And number 5, carditis is a lethal complication of rheumatic fever, assessing the apical pulse for a full minute, checks for arrhythmias and tachycardia. 3 and 4 are incorrect because a tracheostomy is not required for chorea or carditis. And number 4 is also eliminated because active range of motion exercise will worsen joint pain and increase myocardial oxygen demand in a child with carditis. 22, the answer is Charlie. 23. A 10-year-old child is in the hospital on bed rest with a diagnosis of rheumatic fever complicated by carditis. When a nurse responds to the child's call bell, the child states, "I hate this. I want to get up and play." Which of the following responses is appropriate for the nurse to make at this time? The correct answer for 23 is letter D. Severe carditis requires strict bed rest to decrease cardiac workload, and a school-age child will experience distress due to immobilization and diverting their energy with age-appropriate, quiet, sedentary activities like video games. Respects the medical restriction while mitigating boredom and frustration. Letter A is eliminated because this is a dismissive response that offers no coping solution. And B and C are also eliminated because the nurse cannot compromise medical orders such as bed rest or promise changes without provider consent. 23, the answer is Delta. 24. An 8-year-old girl who is complaining of a really bad sore throat and whose temperature is 102.2 degree Fahrenheit is seen in the school nurse's office. The nurse has a child lie down in a room away from the other children. Which of the following statements is most important for the nurse to convey when calling the child's parents? The correct answer for 24 is Alpha. A severe sore throat combined with a high fever strongly suggests bacterial infection like Group A streptococcus, because untreated strep infections can lead to serious sequelae like rheumatic fever or glomerulonephritis. The priority is urging the parents to get a child medically evaluated for a throat culture. Choice B, C, D describe a symptom and social concern but fail to provide the critical, actionable medical directive needed to safeguard a long-term health. 24 answer is alpha. 25. A child has been diagnosed with Kawasaki disease. Which of the following signs and symptoms would the nurse expect to see? The correct answer is only letter D, which is 4 and 5. Because Kawasaki disease diagnosis criteria include conjunctival injection without exudate, there's presence of reddened, crushed eyes, and discoloration or peeling of the skin of the hands and feet during the subacute phase. Choices 1, 2, 3 are incorrect because presence of diarrhea, vertigo, and purple rash are not their diagnostic criteria for Kawasaki disease. And the classic rash is a polymorphous exanthema, and it's actually not eye purpura. 25 is a delta. 26. A 2.5-year-old child is in the hospital with Kawasaki disease. Which of the following actions by the nurse is important for the child's psychosocial care? 26, the correct answer here is bravo. Because a 2.5-year-old child is in toddler stage of development and toddlers experience intense separation anxiety when hospitalized. A transitional object like a favorite blanket or a teddy bear provides a security and emotional comfort in an unfamiliar environment. Choice A is eliminated because isolation is not strictly required for Kawasaki disease as it is not contagious. Letter C is also eliminated because board games are developmentally advanced for a 2-year-old and that is appropriate for school-age child. Letter D is also wrong because showing masks might frighten a toddler rather than soothe them. 26 is bravo. Let's proceed now to D3, care of pediatric clients with immune disorder. 27. A child has been exposed to a viral illness. The child's B cells have been activated. The nurse determines that a child's body has undergone which of the following physiological responses? Is it red blood cells have increased in number, platelets are migrating to the respiratory tract, lymphocytes have begun to produce antibodies, or interferon and enzyme production is inhibited? 27, the correct answer here is letter C. Because humoral immunity relies on B cell activation. When exposed to an antigen, B lymphocytes differentiate into plasma cells that produce specific antibodies, which is the immunoglobulins, to neutralize the pathogens. RBCs, letter A for RBC scarce oxygen platelets assist with coagulation, and interferon inhibition does not accurately describe the active B cell response to an infection. 27 is Charlie. 28. A 10-month-old infant has been exposed to chickenpox. The nurse would expect the baby's primary healthcare provider to order which of the following interventions to prevent the baby from contracting the illness? 28, the answer is bravo. Because varicella zoster immunoglobulin provides immediate passive immunity to non-immune high-risk individuals, such as infants under 12 months who are too young for the live vaccine who have had a significant exposure to chickenpox. Choice A, that is for antibiotics target bacteria, not viruses like varicella. Choice C, the varicella vaccine is a live virus short shot given only at 12 months of age or older. And the maternal antibodies for chickenpox usually wane significantly by 10 months of age. 28, the answer is bravo. 29, a nurse is coordinating an educational session for middle school students regarding human immunodeficiency virus. The nurse should advise students that which of the following behaviors place them at high risk for contracting HIV. The correct answer for 29 is D, 2 and 4. Oral intercourse involves mucous membrane contact with potentially infectious bodily fluids like semen or vaginal secretions or blood, presenting an HIV transmission. Number 4, natural skin, lambskin condoms have microscopic pores that allow viruses like HIV to pass through. Only latex or polyurethane condoms effectively block HIV. Choices 1, 3, 5 are actually incorrect because HIV is not transmitted through casual contact such as saliva, shared food, or standard beverage containers. That's why we eliminate choice 1, 3, 5. 29, answer is delta. 30, a young woman is being seen in the women's health clinic. She states that she had unprotected intercourse about 1 month earlier, and she's worried that she may have contracted HIV. Which of the following signs symptoms would indicate that her worries may be correct? 30. The correct answer here is Charlie. Because the acute primary HIV infection, there is seroconversion phase, typically presents 2 to 4 weeks after exposure with non-specific flu-like symptoms including profile fatigue, myalgia or muscle aches, there's presence of fever, and lymphadenopathy. Choice letter A, macular papular chest rashes, severe abdominal cramps with diarrhea, and menorrhagia are not standard clinical hallmarks of acute primary retroviral syndrome. 30. The answer is Charlie. 31. A 19-year-old man reports to a nurse that he had unprotected anal intercourse with a man 3 years earlier. When the nurse suggests that the patient have an HIV test, he states, "Why? I'm fine. I don't have any symptoms at all." Which of the following responses by the nurse would be appropriate to make? Answer for 31 is Delta. Because HIV has a long clinical latency period that can last anywhere from 2 to 10 years, during which an infected individual remains completely asymptomatic but highly infectious. Testing is vital regardless of how healthy a person feels. And choice A and B, these statements present false medical information about transmission risk and symptom tracking. And telling a patient there is virtually no chance they are infected after unprotected anal intercourse is inaccurate and counterproductive. 31. Delta. 32. The nurse is providing HIV education to a group of individuals. During the session, the nurse discusses actions that have been shown to reduce the transmission of HIV. Which of the following information did the nurse include in their session? 32. The correct answer is Alpha. Because extensive clinical trials have demonstrated that male circumcision reduces the risk of heterosexually acquired HIV infection in men by approximately 60% due to the removal of susceptible mucosal tissue in the foreskin. And B, antiretroviral medications manage the virus but do not eradicate it or cure HIV. And C, there is currently no approved preventive vaccine for HIV. And D, breast milk can transmit HIV. In developed nations where clean water and formula are accessible, HIV-positive mothers are advised not to breastfeed. 32, answer Alpha. 33. A nurse caring for a child with emergency department is struck by a contaminated needle. Which of the following actions should the nurse perform? The nurse should advise the client. The nurse should 33. The correct answer is Delta. Occupational post-exposure prophylaxis with antiretroviral medications must be initiated as quickly as possible, ideally within hours and strictly within 7 to 2 hours window following exposure to prevent the virus from replicating and establishing systemic infection. Letter A is wrong because healthcare workers cannot legally force a client to undergo testing without informed consent, and then baseline testing for the nurse must happen immediately day 0 and not delayed by day 7. And letter C is also wrong because there is no standard in HIV immunoglobulin used for needle sticks. 33, answer Delta. 34. A nurse is providing teaching session for adolescents and their parents regarding HIV. Should the following information should the nurse include in the teaching session? Which select all that apply? 34. The correct answer here is Charlie. 235. Multiple partners increases statistical exposure probability. Viral superinfection contracting a different strain can accelerate disease progression. And hepatitis B, C, and HIV share identical transmission pathways, such as bloodborne or sexual. Contracting one signifies high-risk exposure behaviors for the others. Options 1 and 4 are incorrect because current CDC guidelines state that everyone aged 13 to 64 should be tested for HIV at least once. And number 4, highly active antiretroviral therapy has transformed HIV into a manageable chronic illness, and many patients have near normal lifespan and do not automatically die within 20 years. 34, answer Charlie. 35. A 12-year-old girl has been diagnosed with systemic lupus erythematosus. Which of the following information should the nurse include when educating her and her parents regarding the disease? 35. The correct answer is Charlie. SLE is a chronic inflammatory autoimmune connective tissue disease, and joint pain and mild arthritis are common symptoms that are initially managed with NSAIDs like ibuprofen or naproxen to suppress inflammation. Letter A is wrong because SLE is a lifelong chronic illness with no definitive cure, and letter B is also wrong because SLE is an autoimmune disorder, not a viral infection. And letter D is also wrong because with hormonal shifts during puberty can influence flare stating that antibodies were explicitly triggered by pubertal changes is misleading simplification of a complex genetic environmental etiology. 35 is C. 36. A nurse is providing an education to parents of young children regarding the child's potential for developing allergies. The nurse informs the parents that which are the most common allergies of childhood. 36 answer. Bravo, bravo. Food allergies such as milk, eggs, peanuts, tree nuts, soy, and wheat represents the most common type of allergic hypersensitivity reactions diagnosed during infancy and early childhood. While medications, pets, and plants are prevailing triggers, statistical epidemiological tracking confirms food allergens emerge first and most frequently in early pediatric age brackets. 36 is bravo. 37. The nurse is providing education to pregnant women who have a family history of severe allergies, which are the following information to the nurse convey regarding actions the woman should take to minimize their children's potential for developing allergies. 37. The correct answer here is Delta. Because current pediatric immunology guidelines emphasize that introducing complementary or allergenic solid foods early, around 4 to 6 months of age, once basic low allergy solids are tolerated, it helps induce immune tolerance and decreases the lifetime risk of developing severe food allergies. Letter A is eliminated because restricting maternal diets during pregnancy and lactation does not prevent childhood allergies. And letter B is also wrong because soy formulas are highly allergenic themselves and are not a blanket preventive recommendation over cow's milk. And letter C is also wrong because delaying solids until 7 to 8 months actually increases allergy risk. 37 answer Delta. 38. A child weighing 80 pounds has been prescribed an EpiPen. Which of the following information should the nurse include in the medication teaching for the parents and the child? 38 answer is Delta. That is to ensure the entire dose of epinephrine delivers cleanly from the auto-injector into the tissue. The EpiPen must be held firmly against the upper thigh for at least 3 to 10 seconds, depending on the specific manufacturer holder guidelines, and traditionally taught as 10 seconds in a classic nursing questions. And letter A is wrong because EpiPen should be stored at room temperature, never refrigerated, as extreme cold can damage the injector mechanism. Letter B, auto-injectors are built to be delivered straight at 90-degree angle into the thigh. And letter C is also wrong because the correct anatomical site is the anteroposterior aspect of the thigh or the vastus lateralis and never the gluteal muscles. 38 answer Delta. Let's proceed now to Part D, care of clients with or in pediatric client with infectious disorder. 39. A 1-year-old child is being seen in the pediatrician's office. The child is up to date in all immunization. The mother asks, will the child need to receive any shots today? Is the following responses by the nurse is appropriate? The correct answer here is Alpha. Because according to standard CDC immunization schedules, the first doses of MMR, varicella, and hepatitis A are routinely administered immediately after the child's first birthday, or between 12 and 15 months of age. And letter B is wrong because the third Hep B dose is typically completed by 6 to 18 months, but it's not uniquely tied to the 1-year mark like MMR or VAR. Letter C, the first influenza vaccine can be given as early as 6 months, and the rotavirus series must be entirely completed by 8 months of age, and it cannot be initiated or given at 1 year. 39 answer is Alpha. 40. The nurse advises a pregnant woman, 30 weeks gestation, that she should receive a vaccine to protect the baby from a serious infectious disease. These are the following explanations should the nurse provide the woman. The correct answer here is Bravo. Because the Tdap vaccine is strongly recommended to pregnant women during every pregnancy, ideally between weeks 27 and 36, and this timing maximizes the transplacental transfer of maternal pertussis antibodies to the fetus, protecting the newborn during their most vulnerable first few months of life before they can receive their own Tdap shots. And choice A, C, and D are not routinely administered to pregnant mothers to provide passive immunity to newborns. 40, Bravo. 41. A 5-year-old child who has received no vaccination submitted to pediatric unit with a diagnosis of diphtheria, which are the following signs and symptoms would the nurse expect to see? 41. The answer here is bravo. And that is Corynebacterium diphtheria produces a toxin that causes a thick, asymmetric pseudomembrane covering the tonsils and the pharynx. This leads to marked local lymphadenopathy and soft tissue swelling, historically referred to as bull neck. Letter A is wrong because macular rashes point toward measles or rubella, and strawberry tongue is classic for scarlet fever or Kawasaki disease. And conjunctival hemorrhages are linked to severe pertussis or whooping cough, spasm, or trauma, not a diphtheria. 41 is letter B. 42. A school-age child whose parents are accompanying him has been admitted to the pediatric unit on droplet isolation should the following. Should the nurse include in the admission information for the child? Answer for 42 is letter A. Patients placed on a droplet isolation can leave the room only for essential medical procedures, and they must wear a surgical face mask during transport to prevent spraying infectious respiratory droplets into the communal air. Letter B is eliminated because droplet isolation does not place a 15-minute restriction on a parental presence, and whooshing air pressure describes negative pressure isolation rooms used for airborne transmission like TB or measles, not a droplet isolation. And letter D, droplet precautions require a mask, but caps, gowns, and full coverages are reserved for strict contact protective isolation protocols. 42, the answer is alpha. 43. An unimmunized child with a serious puncture wound has been diagnosed with tetanus. Which of the following actions is critical for the unit charge nurse to perform? 43, the correct answer is bravo. Because tetanus toxins induce profound neuromuscular hyperexcitability, causing severe generalized muscle spasm or opisthotonus and tetanic seizures. Padding the bed, rails, and headboard is critical for physical safety interventions to protect the patient from trauma during severe spasm. Letter A is wrong because tetanus is not transmitted from person to person. It requires standard precautions, not contact precaution. Letter C is also eliminated because tetanus is not communicable, so the immunization status of the staff does not dictate assignment. And tetanus is bacterial, so antivirals are useless. 44. The parent of an infant who has received an injection of polio vaccine, why can't my child have oral vaccine like I did as a child? I don't want the baby to receive any more injections than are necessary. Should following responses would be appropriate for the nurse to give? For the correct answer is Charlie, because the OPV is a live attenuated virus that is no longer administered in the United States and mainly developed nations. It was replaced entirely by the inactivated polio vaccine to eliminate the rare risk of vaccine-associated paralytic poliomyelitis. And A and B was adopted primarily for its superior safety profile regarding paralytic mutations, not because the oral form lacked efficacy or speed. And D, the adjustments was not based on infants spitting out the fluid. 44 is Charlie. Apologies for the background. 45. An 8-year-old African immigrant is admitted to the pediatric unit with elevated viral titers for the poliovirus. For which of the following signs and symptoms should the nurse carefully monitor the child? Answer for 45 is Delta. Because poliovirus attacks the central nervous system, specifically destroying motor neurons in the anterior horn of the spinal cord and the brainstem. This can lead to a bulbar polio affecting the respiratory center and causing respiratory muscle paralysis, which manifests as bradypnea or respiratory arrest. The tinnitus, fatigue rashes, and flank pain are not key neurological or systemic assessment findings associated with paralytic poliomyelitis. 45. 46. A 10-year-old child who has been positively diagnosed with influenza is to be cared for at home by the child's parents. Which of the following client care information should the nurse include in the teaching? 46. The correct answer is Delta. Influenza is a viral infection. Children and adolescents with viral infections never receive aspirin due to the risk of Ray's syndrome, a rare but fatal condition causing acute encephalopathy and liver infiltration. Acetaminophen or ibuprofen are safe choices for fever, pain relief. Letter A, influenza viral shedding typically lasts about 5 to 7 days, not full 2 weeks. And antibiotics have no effect on viral infections like influenza. And a sore throat is a standard symptom of the flu and does not automatically require an emergency room visit unless accompanied by respiratory distress. 46 is Delta. 47. A child who has been diagnosed with rubiola is being cared for at home. Should the following actions would the nurse educate and the parents to perform? 47. The answer is A. This rubiola or measles causes severe photophobia or extreme sensitivity to light. Dimming the lights in the child's bedroom significantly improves physical comfort. Options B, oatmeal baths are highly useful for the intense itching of varicella, not the maculopapular rash of measles. And letter C, calcium supplements are not a recognized treatment for rubiola, and measles spreads via the airborne route. Home care requires standard supportive care while keeping them out of public settings, but contact isolation does not block airborne droplets. 47 is letter A. 48. The parents of a boy who is diagnosed with mumps ask nurse whether there is any special care that they should provide their child, which the following responses would be appropriate for the nurse to provide. The correct answer here is letter C. 1, 2, 4. Mumps causes severe parotid gland swelling, making chewing highly painful. Soft foods minimize jaw in movement. And orchitis, or testicular inflammation and discomfort, is a common painful complication of mumps in post-pubertal males. And number 4, an ice collar or warm compress helps soothe the painful swollen parotid gland in the neck. Choice 2 and 5 are incorrect because citrus juices are acidic and stimulate saliva production, which causes excruciating pain in the inflamed parotid glands. And number 5, mumps is a viral infection causing glandular swelling. Antihistamines are not a standard therapeutic interventions for managing it. 48 is letter C. 49. The nurse is reviewing the record of a woman who is planning to become pregnant. So the woman is not immune to rubella. In addition to recommending that the child have MMR, which vaccine should the following actions should the nurse take? The correct answer for 49 is Bravo, because MMR vaccine contains live attenuated viruses because of the theoretical risk that the live virus could cross the placenta and cause congenital rubella syndrome in a developing fetus. Women are strongly advised to avoid becoming pregnant for at least 4 weeks after receiving the vaccine. And A, immunity must be quicker than 1 year, usually within few weeks. And letter C, the vaccine protects the mother. It does confer lifetime active immunity for future offspring. And letter D, for adults, a single dose is standard for rubella immunity confirmation unless part of the specific catch-up series. It does not routinely require 3 separate injections over few months. Last number, a nurse is educating a group of parents regarding ways to prevent diseases in their home. Should the following information should the nurse include regarding preventing the transmission of hepatitis A? The correct answer here is A, because HIV is transmitted by the fecal oral route. Common vectors include contaminated food, water, and shellfish. Thoroughly washing fresh fruits and vegetables before ingestion breaks the transmission cycle. And letter A prevents airborne droplet like influenza, not fecal oral diseases. And this letter B targets bloodborne pathogens like hepatitis B, C, and HIV. And letter C is also wrong because washing clothing in a hot dryer is effective for parasitic infestations like scabies or lice, but it is not primarily the mechanism for preventing foodborne hepatitis A outbreaks. So that is it. Thank you so much for listening. See you around.